People will think, oh, that's very superficial and people want to be young forever. Or they just want to look perfect. It's deeper than that. You know, you'll have someone that maybe was a victim of domestic abuse and they broke their nose. And every time when they look in the mirror, that's what they see. They see that broken nose and it takes them back to that time. They're in traumas or cancer or something where their face has changed and you're able to give them that back of looking in the mirror and seeing themselves. You get to help give people part of themselves back, be able to help them interact with their family members, their partners, their job, everything in a more positive way. I could help you see yourself again, reconstruct something that's very important and intimate to that person. And that's something I just really love and really love being a part of that process. You keep that essence of you a little bit better. And that's what I want for my patients, just to be able to just be yourself and, let go of those things that bother you and just come into more yourself. That's the perfect result.
I'm gonna kick back when you fake like that.
So welcome to Beauty Unveiled. I am Dr. Angela Sturm. I'm a facial plastic surgeon in Houston, Texas. With this podcast, we're going to explore the backgrounds and the stories of plastic surgeons and plastic surgery, how we got to the places that we are, what made us who we are, and answer some of your questions that you always wanted to ask but didn't have anyone to ask about plastic surgery. I will start with myself, and I'll introduce you to some of the people that are around me and that have influenced me and I get to interact with every day. Like I said, I'm a facial plastic surgeon. I grew up in a small town in West Texas. None of my family was in medicine, so this was totally different from what we knew. Not a conversation anyone ever had when I was growing up about having plastic surgery or anything related to that. The medical care was not great because it was a small town. There are only so many resources, and it was something that I became interested in pretty early as a child. I went to see my pediatrician, and I told them my uvula was swollen, and he asked me what that was, and I thought, I can do this. I think I can do this. It can't be that hard. So I went to college and thought maybe I wanted to do some research with medicine and got into that and realized that just wasn't really my passion. It's very interesting and they do some amazing things, but I really enjoy the people part of it more. I'm not a stand in front of 1 million people and talk person, but I'm a group of 1 to 3 people. That's my space where I'm very comfortable and happy. And like I said, I like to get to know people's stories. So I went into medical school, first person out of my family to do that. So they all kind of thought I was crazy and kept asking me when I was going to get a real job. I said, not for a while. And I thought I wanted to be an OB-GYN because I really like women's health. And I like, being able to be there for very special parts of people's lives. And you really get to be that person for a lot of people. But there's parts of it I really liked and parts of it I didn't know that really fit for me. And as a med student, I did a rotation where I watched a surgeon take a rib and carve it into an ear for a child, and I thought that was the absolute coolest thing I've ever seen. How was your day? Oh, I got to make an ear, no big deal. And I really got interested in, okay, well, what do? You're a facial plastic surgeon. What does that mean? You get to help give people part of themselves back. If they're in traumas or cancer or something where their face has changed and you're able to give them that back of looking in the mirror and seeing themselves. And I just absolutely fell in love with that. It's something I could continue to do. That same idea of women's health where I get to help people with something more than just that moment. Just here's your prescription for your high blood pressure. I could help you see yourself again, reconstruct something that's very important and intimate to that person. And then that translates into like facial rejuvenation. As we age, you feel 20 and you look in the mirror and it doesn't look the same anymore. Where did that person go? And so if there's something I can do to help lift things where they're supposed to be, where they used to be, and you look in the mirror and you say, hey, that's me again. That's wonderful. And that's something I just really love and really love being a part of that process. And so kept going down that road of facial plastic surgery, and was from Texas. And I said, I'm going to leave Texas. I'll do my training here, but I'm not going to stay. But here I am. It's a wonderful place to be, and it's a wonderful place to practice. And I love the people here. Everyone is so friendly and giving, and they say, oh, you need a website? I got a website guy. Oh, you need this. The people are really wonderful. So I was very happy to actually end up staying, even though that wasn't necessarily my plan. So it's 10 years, 11 years of being in practice in Houston. And I really love being here. It's been a great place to start my practice, to be able to grow, to get to know a lot of people, people that do a lot for the community. And that has been something that's been a wonderful thing for me, is people that care about other people and do a lot to give to them. And that's something that's important to me, is I'm able to grow my practice, do something that I can give back to people individually, but then also as a practice and as a physician, give to the community and do good things for them. And so it's been this great evolution of, through growing my practice, I met these people and I'm able to do the things that I wanted to do to be able to give back. So it's just kind of this great circular thing that has been being in Houston and being able to do the things that I want to do. Even though who would have thought I would have ended up being a facial plastic surgeon. But here we are. And Houston is also a great place to raise my 2 girls. If you'd have asked me 10 years ago if I'd been here, I would have said no. I'm very much identified with being like the businesswoman, no kids, traveling sort of thing, but life's been great and it's changed in a different direction that I did not anticipate. And I have 2 beautiful girls and a great partner that we are able to raise them and be in a place like this, that there's such diversity and wonderful people, and they can grow and just be around different people and different perspectives to have that wonderful thing, in their life. And so hopefully be able to translate some of that giving back to the community to the girls, and they have that as part of who they are as well. And with this podcast, I would like to not only share things about plastic surgery behind the scenes, how things work, questions you might have, and maybe want to ask, don't want to ask, but want to know the answers, but also share people's stories, because we all have interesting stories that have brought us here in medicine, brought us here to Houston, brought us doing the practices that we're doing. And I think those are interesting stories. I'd love to also touch on different topics. So if you have different topics you would like to hear about, definitely let me know. If you have people that you think, oh my gosh, they're super interesting, let me know. I have a lot of patients that I think are very interesting. I'd love to tell their stories too. So through their eyes, if their process, how did they decide to have surgery? How is the process? And then also just who they are, because they have very cool journeys as well of doing one career and then changing and doing another, and what makes us make those changes in life. So if you're considering having facial surgery and you just don't exactly know what it is or what you're looking for, a lot of us will go to Google and say, okay, well, what can I find? And a lot of times what we're looking for is maybe like rejuvenation. And so people will look for, like, how can I look younger? How can I look more like myself, more like a 20-year-old, whatever the goal is. And a lot of times these are changes you'll see around the eyes. And then maybe you go down the rabbit hole of like eyelid surgery. That's one of the earlier changes we'll see, because it is more genetic than it is actual aging changes. Those are procedures that are very low downtime. They're not very painful. The incisions heal very, very well. So a lot of times those are things that people will ask. The biggest thing is, does it hurt? For eyelid surgery, the basic answer is no, it really doesn't. We give you a few pain pills, but it really, you don't even really need them. The incisions heal really well. You really don't even see them as soon as after maybe a week or two, and then make a big difference without having a huge downtime. So if you're super, super nervous and that's something that applies to you, that's a great first little step into how can I make myself look a little bit better? How can I look a little bit more rejuvenated? Like I said, has very minimal signs of having surgery, because a lot of people will say, can you tell that you had surgery? And most eyelid surgeons do a very good job. You look natural. You look like yourself. You don't look like you've had surgery. So those are the things to look for whenever you're searching for your surgeon, is to make sure you look like you and you like their aesthetic. You can see their before and afters and you say, yeah, I like the way that looks. Find someone that looks like you and say, how did that person do? What is their outcome like? The other thing you might find is skin changes. Do you have brown spots? Do you have wrinkles? Do you have redness? Everyone has a little bit different changes of your skin that maybe we want to improve. We want to look better. Remember, hey, where did this new brown spot come from? I never had that one before. And those are usually non-surgical. So those are lasers that we can do. They're peels, they're skincare. That is a lot more accessible for a lot of people. So financially and downtime wise, those are things that are easier to do. They're a little bit less scary, and honestly, a lot of times a good place to start. Because if you have good skin, we forgive a lot of other things. You say, oh, she has great skin, and they're going to think that you're 5-10 years younger just from that. And that's very simple and it's easy to do. Other things you may see is a lot of people are not happy with their neck, because our face may look great and then your neck gives you away. You have that extra skin, or it's full there, or, I see a lot of men that will say, oh, I have this turkey neck. All of a sudden, just get rid of the turkey neck. But with the Zoom boom after COVID, it's everybody. It's women, it's men, everybody. Because we all stare at ourselves in that screen and think, oh my gosh, is that what it looks like? And usually it's not as, that screen is not the best. But so we see more and more people who are interested in that because we're noticing it. We see it. It's there. And there's different things you can do. There's non-surgical, so skin tightening, things like radio frequency with microneedling can be a lower downtime way to address that without having surgery. The less downtime you have, usually the less results you have. So it's kind of a give or take. If you don't have a lot, maybe that's the perfect thing. You just have a little bit of tightening and it's perfect. You don't need a lot. Like I said, a couple days off of work, and that's really all you need. All the way up to having something like a facelift, which can be amazing and just rewind that clock like 10, even 15 years. And if you did that and never did anything else, you're pretty much always going to look 10, 15 years younger. So it's not like you do this and you have to keep up with it and you have to keep doing it. You're good for ever, really, if you wanted to, but a lot of people, once it's one of those things, once you do it, you see it, and then you really like the way that looked right after you did it. So when you start to see the little sag of the jawline or under the neck, that you may want to do something else. And that doesn't mean it's going to be surgery, but maybe it's something non-surgical, just to maintain that result that you have. Or some people will wait like that 10 years or so and then do the surgery again, just depending on the person and what they want. Some people, that's it. They want go big or go home. That's what they want. And then other people were able to kind of maintain what they have, with little tweaks along the way. So people really don't notice. And that's the thing for me, is I really want to have a nice aesthetic, natural result, so other people don't know that you've had anything done. It's the perfect result for me. If they can't put their finger on it, they know you look good, but maybe it's your hair, they don't really know, or you always just look good and they can't figure it out, but they don't think, oh, you've had surgery. The last thing I want is one of my patients walking in and say, oh, you did this or you did that. You definitely don't want that. You don't want people to know what it was. But like I said, it's that subtle, natural result that other people don't notice. But whenever we look at your before and afters and we pull it up, we say, wow, oh my gosh, that's amazing. Oh, that's the perfect result for me. And the nice thing about that too is people don't notice things as much as you think they do. It can be really dramatic, and we look at the before and after, we're like, oh my gosh, this skin is gone. That's incredible. But they thought you looked beautiful before, and so they just say, oh, you just look beautiful, and that's perfect. You keep that essence of you. You just look a little bit better, the things that bothered you aren't there, so you don't even have to worry about them anymore. You don't have to worry about, oh, I only take pictures from this side at this angle and I hold my chin like this, okay, and throw away every other picture you take, that you can just take the picture and you just don't worry about it. And that's for my facelift patients and my rhinoplasty patients. It's the profile and the 3/4 and the you just take the picture and you just don't worry about that. There's enough in life for us to worry about And if we can get rid of one of those things, like if you could, absolutely, and feel good about yourself. I personally had my nose done at the end of my fellowship by my fellowship mentor, and the thing my mom said to me is, well, we should have done this sooner, because she could tell how much more confidence that gave to me of not having to worry about that, not worrying about that thing that I was insecure about, and it's not like I spent a ton of time, or I didn't even realize I spent so much time thinking about it or it holding me back. But when it wasn't there, other people could tell, and I could tell too, that was one less thing holding me down from just being myself, and that's what I want for my patients, just to be able to just be yourself and, let go of those things that bother you and just come into more yourself. Hence the Beauty Unveiled. Unveil your beauty, because it's there and you're already beautiful. Just how can you let everyone see exactly who that person is? And that ties into some of the other reasons why I wanted to do this, is be able to help people see themselves more and be more themselves, and it be more than just medicine. Be able to help them interact with their family members, their partners, their job, everything in a more positive way. One of the things that I've made a point since the beginning of starting this is how people see plastic surgery and what that means. And people will think, oh, that's very superficial, and people want to be young forever, or they just want to look perfect, or, and it's deeper than that. And there are things people don't even realize about this. You'll have someone that maybe was a victim of domestic abuse and they broke their nose, and every time when they look in the mirror, that's what they see. They see that broken nose, and it takes them back to that time. And so it's not just fixing a nose, it's making it so when they look in the mirror, that's not what they see. They see them. They see, I did something about this. I was able to take control of that moment and take control of that thing that was really, really bothering me and fix it. I was able to do something about that, and now what's there is me. That's not what happened to me. This is me taking control of that. And so it's being able to help someone with that process of saying, okay, that happened, and I'm acknowledging that, and I'm doing something about it, and it's kind of a hard process for people, because in a way you have that, and then you have to live through having surgery and having bruising and swelling and all the things that might have happened whenever you initially broke this nose. So you go through those emotions again of, this is something that happened. But you're doing it from a place of, I'm making it better. I'm dealing with this and I'm making it better. And then you can see the difference, and you can see, now this is me. I went through that. It was difficult, and I kind of had to relive it in some ways, but now it's me. And you can look at that in such a more positive space and a positive mindset from it, and being able to go down that road with a few of my patients. It is emotional, and you do get involved, and you feel that with them, and it's hard for you too, because you're like, I feel that with you, that's deep. But you also have that joy on the other side of it. That's also, you're part of that too. And that's what I really love, is being able to do that with that person and be able to hold their hand through that situation, and then celebrate on the other side and say, yay, look, it's you. I see you, and you can move forward in this very confident, powerful way. So that's a little bit about me and my practice, and thank you for joining me today. In this podcast, we're going to learn about some of the other physicians that are around me and that are in my practice and that help influence my practice and my patients and their backstories. We're going to talk to Dr. Samuels and how she went from growing up in Jamaica and where she went to do her training, how'd she end up here. We're going to talk to Dr. Hamill, who grew up here and did his training and came back, and his dad's a doctor, and how does that impact him in this community, and I can't imagine going back to where I grew up, so it's totally different. So you get to hear his story. And then Dr. Steinberg, she has an interesting story of training different places and then ending up here in Houston and how she does plastic surgery. So you get to hear about everybody's story and why they're here, how they ended up here, and what plans they have moving forward. So if you want to learn more about me, my practice, some of my colleagues, please go to our website. It's www.drangela.sturm.com, and follow us on Instagram at Dr. Angela Sturm. And if you enjoyed this episode, please hit the subscribe button and share with your family and friends.